guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering fundamentals, but the subject for fundamentals is going to be the older adult. So as always, guys, if you appreciate the content that I deliver every week, please share my video. Also, don't forget to like and subscribe below. Leave me a comment if there's anything you'd like to see me cover. So without any further ado, guys, let's get started. First question. A nurse is performing a physical examination on an older adult client in an assisted living facility. On completion of the examination, the nurse compares the result to findings expected for individuals in this age group. An expected finding for this client is 1, increased tactile responsiveness, 2, increased sensitivity to visual glare, 3, increased hearing acuity for higher tones, or 4, increased thoracic expansion during ventilation. And I'll give you a moment to think of your answer. If you're new to my channel, guys, just go ahead, press that pause button, and whenever you're ready, when you think you know what the answer is, you can press play to resume. So the correct answer, guys, is increased sensitivity to visual glare. So what happens in the older adult, as they age, it's wear and tear of the body. Their eyes get more sensitive to glare. And so what happens is the more responsible older adults, what do? They realize that at a certain point, if it's bad enough that the glare is too much, they can't drive anymore. They'll have a family member or a friend drive them at night. Okay, but that is a physiological, normal response to aging, that at night, they're more sensitive to glare. So let's look at our wrong choices. You have choice 1. It says increased tactile responsiveness. That's not a normal finding of aging. Okay. Then you have 3, increased hearing acuity for higher tones. That's wrong. Actually, as the adult gets older, they have a decreased for higher tones. So that's why with the older adult, you want to speak in a lower pitch, because the higher pitch is harder for them to hear those sounds. And of course, choice 4, increased thoracic expansion. That's incorrect. As the patient gets older, they actually have decreased thoracic expansion. Okay, so the correct answer for this is increased sensitivity to visual glare, and I explained why. Guys, let me explain something else to you. I know all the time in all my videos, you always see me going like this. I don't know why. I can't figure out what it is in this room that I tape in that I have a runny nose. Like, I'll be fine all day, and as soon as I can't even blame it on this room, because I tape in other rooms too. The minute I start taping, my nose starts running. I don't know why. So I'm sorry you see me going like this. It's just because I don't want to have a runny nose all over this video. Moving on. Next question. A 70-year-old client asked the nurse to explain her hypertension as she's to have her blood pressure checked each shift. An appropriate response by the nurse as to why older clients often experience hypertension is because of 1, myocardial muscle damage, 2, reduction in physical activity, 3, ingestion of foods high in sodium, or 4, accumulation of plaque on arterial walls. And I'll give you guys a moment to think of your answer. And the correct answer is 4, accumulation of plaque on arterial walls. So let me explain to you what's happening here. The older that a patient is, the more time that they've spent on earth eating pizza and French fries and KFC, anything fried, anything greasy, right? Because guess what? Those greases turn into what? Fat and lipids. You want to know what those fats and lipids do? They stick to the arterial walls, right? So they're sticking to the arterial walls. The arterial walls are supposed to be this wide so blood can flow, right? But then you have all this fat, all these lipids, they're sticking to the walls. And what is it doing? It's narrowing the airway. Guys, don't worry about me. I'm crazy this morning. It's narrowing the vessel, right? It's narrowing the vessel. It's narrowing the vessel. It's narrowing the vessel. So what used to be this big for blood flow is now only this big for blood flow. Why? Because all the fat and lipid that has accumulated and stuck to those vessels that end up causing what? Heart disease. So that's why in the older adult, you tend to see more high blood pressure because they've had more time on this earth. If you're young, you're in your 20s, you're in your 30s, you're eating all of these foods that are high in fat, high in these greases and oils, right? You don't see the effect of that until you're an older adult, until you're in your 60s and your 70s. So that's the correct answer. This is why number 4, accumulation of plaque on arterial walls. Okay? Next question. In reviewing changes in the older adult, the nurse recognizes that which of the following statements related to cognitive functioning in the older adult is true? 1, delirium is usually easily distinguished from irreversible dementia. 2, therapeutic drug intoxication is a common cause of senile dementia. 3, reversible systemic disorders are often implicated as a cause of delirium. Or 4, cognitive deterioration is an inevitable outcome of the human aging process. And I'll give you a moment to think of your answer. And the correct answer is 3. Reversible systemic disorders are often implicated as a cause of delirium. So guys, let's get this straight. You have to know the difference between delirium and dementia. So let's talk about delirium first. Delirium is 1, reversible, right? So it's something that's causing the delirium, but as soon as that something is cured, is resolved, the delirium goes away. So delirium can be caused by an infection. A patient has a urinary tract infection. All of a sudden, they think that you're their great-grandmother. But as soon as you clear up that infection, they're not confused anymore. That's delirium. A second thing to know about delirium, delirium has a quick onset. All right? It happens very, very quickly. Now, dementia on the other side, dementia is progressive. That means as time goes on, it gets worse, okay? It's gradual. Unlike delirium, dementia happens very slowly. It's insidious. What does insidious mean? That means it's sneaky. It happens very sneakily, like it happens and you're like, when did this even happen, right? It's not as abrupt like delirium is. And I don't know how many points I made, but I think I made 3 points, so I'm going to say 4. The fourth point about dementia is that it's irreversible. Dementia is the underlying cause. So what's happening is the patient's brain is, for all intents and purposes, is deteriorating. And you guys know brain cells don't regenerate, right? Once it's gone, it's gone. So this person's brain is deteriorating. So there is no reversal. There is no cure. There is no underlying cause to get rid of to make their cognition come back. Okay. So those are the biggest difference between dementia and delirium. And you guys do have to know that difference. So again, number 3 is the answer. Let's go over the wrong choices. You have number 1, delirium is usually easily distinguished from irreversible dementia. It's not in the older adult, okay? So it's going to take what? In-depth assessment. You have to be able to assess your patient. 2, therapeutic drug intoxication is a common cause of senile dementia. No, it's a common cause of delirium because as soon as you clear up that drug intoxication, their cognition comes back. Number 4, cognitive deterioration is an inevitable outcome of the aging process. No, this is not a normal outcome of the aging process. Okay, this is abnormal. Having dementia is not normal part of aging. So any patient that you see a change in their cognition, that warrants attention. That warrants more assessment. Don't just think that it's just normal because they're elderly, because that's not the case. Okay? A client's been recently diagnosed with Alzheimer's disease. When teaching the family about the prognosis, the nurse must explain that 1, diet and exercise can slow the progression considerably. 2, few clients live more than 3 years after diagnosis. 3, many individuals can be cured if the diagnosis is made early. Or 4, it usually progresses gradually with a deterioration in function. And the correct answer is 4. When it comes to dementia, not delirium, dementia, it happens very gradually, very slowly, very insidiously, okay? And there's no reversal, and you're going to see a decline in function. So here's what's happening with dementia, guys. So the very first signs and symptoms the patient normally experiences and family members or close friends will notice is slight forgetfulness. Okay? Slight forgetfulness, not from things that happened long time ago, but just recent things, everyday things. Oh, I forgot a doctor appointment, right? And then it becomes forgetfulness to the patient's driving and they forgot how to get home. Right? And what happens, remember I told you, is deterioration of the brain. So it starts very small, little things, and then their brain deteriorates to the point that the patient will see a toilet and not recognize that that toilet is to relieve themselves. And they might start drinking out the toilet, actually. Okay? Let's look at our other choices. 1, diet and exercise can slow the progression considerably. The only thing that we have that can slow the progression are medications, and even with that, not considerably. It'll slow the progression, but inevitably it's going to happen, okay? Then we have 2, few clients live more than 3 years after the diagnosis. That's not true. After a patient's been diagnosed, many patients can live a decade, even longer. 3, many individuals can be cured. Stop right there. There is no cure. This thing is irreversible. It's progressive. As time goes on, it's just going to get worse, okay? So the correct answer is number 4. The nurse is aware that the majority of older adults, 1, live alone, 2, live in institutional settings, 3, are unable to care for themselves, or 4, are actively involved in their community. And the correct answer is 4. They're actively involved in their community. Regardless of common thought, people think that the geriatric population, they all live in nursing homes, they all need help, they're all dependent. That's not true. The majority of the geriatric population, they're still able to care for themselves. They either live with their spouse or they live with family members, and they care for themselves for the majority of the time, and they're very active in the community. They're active in their church. They're active in their synagogue. They volunteer at the local hospital or animal clinic or shelter, okay? The nurse works with elderly clients in a wellness screening clinic on a weekly basis. Which of the following statements made by the nurse is most therapeutic regarding their mobility? 1, your shoulder pain is normal for your age. 2, continue to exercise your joints regularly to your tolerance level. 3, why don't you begin walking 3 to 4 miles a day and we'll evaluate how you feel next week. Or 4, don't worry about taking that combination of medication since your doctor has prescribed them. And I'll give you a moment to think of your answer. So the correct answer is 2, continue to exercise your joints regularly to your tolerance level. We want the patients exercising their joints so those joints don't get stiff, right? We want them doing range of motion exercises to their tolerance because we don't want them to hurt themselves. Now let's look at our other choices. 1, your shoulder pain is normal for your age. Pain is not normal at any age, so that's wrong. You have choice 3. Why? Stop right there. I literally can't even. How many times have I told you not to ever start a question with why? You don't do that, okay? In nursing, you don't start a question with why. Never, ever, ever, ever. So that's wrong, but let's go ahead with the rest of the question. Why don't you begin walking 3 to 4 miles a day and we'll evaluate how you feel next week? The rest of this is also wrong. 3 to 4 miles a day, we're talking about an elderly client. When it comes to the elderly clients, what do we always do? We start low and go slow. So we're going to tell them start walking 20 or 30 minutes a day and then increase gradually to their tolerance level, okay? We're not going to have them try to get them to walk 3 to 4 miles a day. So that's wrong. Then you have choice 4. Don't worry. Stop right there. Do we ever tell patients don't worry? No. If they have a concern, you have a concern. You never tell a patient, don't worry. But let's go ahead and finish the rest of the question. Don't worry about taking your combination meds since your doctor has prescribed them. Doctors aren't God. They make mistakes, right? If they have a concern, you hear them out. You find out what that concern is. And if you can educate the patient, great. If you got to get the doctor involved, that's what you're going to do. You never tell a patient not to worry. And something else you have to remember, guys, we're dealing with the older population, the geriatric population. Guess what? Their GI tract isn't working as fast as it used to. So they're not absorbing these meds as fast as they're used to, which means what? Those meds are staying in their system longer. The liver is not working like it used to in their 20s or 30s, right? And the liver's responsible for what? Metabolism of the meds. So their liver slows down. Guess what? That med is staying in their body longer. Want to know something else? Their kidneys aren't working the way it used to. It's wear and tear of the body, guys. If those kidneys are not excreting the meds, that patient's holding on to the meds for a longer amount of time. And that's why when it comes to the geriatric population, let's say, I'm just giving you guys a med, labetalol, right? Let's say for a young adult, they would only need 10 milligrams. For a geriatric patient, because of the GI tract, the liver, the kidneys, the doctor might only give them half, 5. Why? Because the meds stay longer in their body and we don't want them to get a toxic level. Remember, your GI tract is responsible for absorption of the med. Your liver is responsible for metabolism of the med, breaking it down, and your kidney is responsible for excretion of the med to get rid of it. If these 3 things aren't working the way they're supposed to, like they used to, the meds are going to stay in the patient's system longer and they're at higher risk for drug toxicity. So any concerns about medication, especially in the geriatric population, we need to take it seriously. We need to address it and ask more questions. So that's why number 2 is the correct answer and not number 4. A long-term care facility sponsors a discussion group on the administration of medications. The participants have a number of questions concerning their medications. The nurse responds most appropriately by saying, 1, don't worry about the medication's name if you can identify it by its color and shape. 2, unless you have severe side effects, don't worry about the minor changes in the way you feel. 3, feel free to ask your physician why you're receiving the medications that are prescribed to you. 4, remember that the hepatic system is primarily responsible for pharmacotherapeutics of your medications. And the correct answer is 3. Feel free to ask your physician why you're receiving the medications that are prescribed to you. Absolutely. Absolutely. You have any questions about the medications, you can ask your physician, or I prefer, and nursing, we prefer you ask your physician, but the physician was not on this list. So our next best is the pharmacist. Now let's go over the other choices. 1, don't worry. I already told you about don't worry. So as a student, the minute you saw don't worry, you should have disqualified that as a choice. But let's keep going. Don't worry about the medication's name if you can identify it by its color and shape. Well, here's the problem. Manufacturers change the color and shape of their medications all the time. Once a study comes out and it says that patients are more likely to take a pill if it's red, guess what the manufacturers do? They change the color to red, right? So we're not going to tell them to take their medication by the color. Absolutely not. Or the shape. Choice 2, unless you have you see that word severe? Remember that video I did on priority and delegation? What did I tell you about severe? You see severe and you're running to that patient because that is bad, 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 bad. So you're telling a patient only if it's severe to worry about something? Absolutely not. Look at this. It says, oh, unless you have severe side effects, don't worry. There goes another clue to let us know that this answer is wrong. Don't worry about the minor changes in the way you feel. If you have a concern, I as a nurse have a concern. So that is absolutely wrong. You're not going to tell them not to worry unless it's severe. If they're having reactions that they're concerned about, they need to let us know so we can investigate further. And then choice number 4, remember that the hepatic system is primarily responsible for pharmacotherapeutic the therapeutics of your medications. And that's wrong, because I just told you there are 3 systems that are primarily responsible, not just the hepatic system. Hepatic, by the way, guys, that's your liver that they're talking about. So not just the hepatic system, your GI system, as well as your renal system, which is the kidneys. Those 3 are responsible for pharmacotherapeutics of medication, okay? In performing a physical assessment for an older adult, the nurse anticipates finding which of the following normal physiological changes of aging. 1, increased perspiration. 2, increased airway resistance. 3, increased salivary secretions. Or 4, increased pitch discrimination. And I'll give you a moment to think of your answer. And the correct answer, guys, is 2, increased airway resistance. Now, remember, what happens is the older adult has what? Decreased thoracic expansion. So those lungs are not expanding the way that they used to. So, of course, they're going to have decreased airway resistance. Okay? Now, let's look at our other choices. 1, increased perspiration. That's wrong. The older client has the opposite, decreased perspiration. Remember on the last video I did, what was it? I think it was the video on middle to older adult, right? So we talked about the older adult just a little bit. But in that video, I explained to you what's happening as far as their skin. Excessive dryness. This patient tends to be what? Dehydrated. The skin is dry. That's why with the older adult, you have to constantly remind them to do what? Drink fluids, drink water, because they're very, very dry. And this patient doesn't have increased perspiration. They have decreased perspiration. Remember? Because of the excessive drying. And that's why the skin turgors more than 3 seconds, right? Choice 3, increased salivary secretions. Wrong. They are dry. They're going to have decreased salivary secretions. And then, of course, increased pitch discrimination. Wrong. It's decreased. Remember, guys, with their hearing, it's hard for them to hear high-pitched sounds. So your correct answer is increased airway resistance. And the reason they're having that resistance is because their thoracic cavity is not that is not increased. Thoracic expansion is decreased. Their lungs are not expanding the way that it used to. So that's why you see that airway resistance. Next question. There are factors that influence the musculoskeletal system associated with aging. The nurse recognizes that with age, 1, men have greatest incidence of osteoporosis. 2, muscle fibers increase in size and become tighter. 3, weight-bearing exercises reduces the loss of bone mass. Or 4, muscle strength does not diminish as much as muscle mass. And I'll give you a moment to think of your answer. All right, guys, the correct answer is 3. Weight-bearing exercises reduces the loss of muscle mass. Okay, so when the patient's doing weight-bearing exercises, it does what? It strengthens those muscles. Okay, now let's look at our other choices. 1, men have the greatest incidence of osteoporosis. That's false. Women have the greatest incidence of osteoporosis, and there's lots of reasons for this. If you want to know, I can't do it in this video because I got so much I want to cover, but make sure you watch my video on ortho. But it's women. Women have the highest incidence of osteoporosis. 2, muscle fiber. I might as well tell you. Let me tell you real quick. So one of the biggest reasons, I'll just go over the biggest reasons that women have more incidence of osteoporosis. Remember, women, we go through what? Menopause. And once the women stop creating estrogen, their bones become more porous, because estrogen is what was keeping the calcium from seeping out of the bones and going back into the blood. Once the estrogen goes down, what does calcium do? Calcium says, ooh, party time. And they leave the bones and go back into the blood, makes the bones porous, and boom, before you know it, patient's got osteoporosis. So that's one of the main reasons why women are more at risk. Choice 2. muscle fibers increase in size and become tighter. That is false. As the patient gets older, the older adult, the muscle fibers actually shrink, okay, and they loosen, they get smaller, and they weaken. And then choice 4, muscle strength does not diminish as much as muscle mass. Yes, it does. In the older adult, it diminishes as much as the mass does. So the correct answer, weight-bearing exercises reduces loss of bone mass. Let me tell you, it makes the weight-bearing exercises makes the muscle stronger, and it reduces the incidence of bone mass. And let me explain to you why. When the patient does that weight-bearing exercise, what does it do? All of that calcium that was having a party and went over to the blood, the weight-bearing exercises pushes the calcium back into the bone. Yeah. So when the patient does weight-bearing exercises, it's like the bones are calling calcium. Hey, calcium, get out of the blood and come back over here in the bone. And the calcium listens, all right? So that's what happens. We love weight-bearing exercises for patients who have osteoporosis, who have porous bones, because the weight-bearing exercises pushes the calcium that went to the blood and brings it back into the bone to make the bone stronger. The nurse preparing to discharge an 81-year-old client from the hospital recognizes that the majority of older adults, 1, require institutional care, 2, have no social or family support, 3, are unable to afford any medical treatment, or 4, are capable of taking care of their own lives. And I'll give you a moment to think of your answer. And the correct answer is 4, are capable of taking care of their own lives. Like I said, I think it was the first or second question. You know, it's a myth. People think that the older adults, you know, they're all dependent. They live in nursing homes. They need a caretaker. They can't take care of themselves. And that's just not true. The majority of older adults can take care of themselves, and they're capable of taking care of themselves. So 1, 2, and 3 are wrong. The correct answer is 4. And guys, I can already tell I'm going to have to make a part 2 to this video, because there are so many important topics that I need to cover, and I did not want to rush through this video. That's why I took my time, and I did not get through half of the video of the content that I want to cover. So I'm telling you now to watch out and be expecting it. There will be a part 2 for this subject. Okay. All right, let's keep going. To assist the older adult in meeting their needs for sexuality, the nurse should recognize that the greatest impact on the sexuality of the older adult is 1, therapeutic medications may alter sexual function. 2, sexual interest declines and then fades completely with age. 3, physiological changes do not adversely influence sexual activity. Or 4, prevention of sexually transmitted diseases is no longer an issue. And I'll give you a moment to think of your answer. The correct answer is 1, therapeutic medications may alter sexual function. So let's talk about this, guys. Remember, I told you in the older geriatric population, toxicity is a problem because these meds are staying in their bodies for longer, okay? And so we have to watch out for that. And something else we have to watch out, because they're older, many of these patients are taking more than one medication, and there can be interactions. And one of the biggest interaction is decrease in sexual libido. Another myth that people think is, you know, the older adult is not interested in sex, and that's false. That's false. The older adult is interested in sex until they die. All right. And let me explain something to you. I don't know if you know this or not, but I'll let you know. The fastest growing age group in the incidence of HIV and AIDS is the geriatric population. So guess what? They're hunching, right? Yeah, they're doing it. They're having sex, okay? The fastest growing age group is a geriatric community that's getting HIV and AIDS, okay? They are sexually active. They like sex just as the young adult likes sex, okay? Here's the problem. Here's what's happening. Because they no longer have to worry about pregnancy, right? The women have gone through menopause. They don't have to worry about pregnancy. They're not using protection. They're not using protection. Okay? And so now they're having sexual relations with someone else that may be having sexual relations with someone else, and they're getting STDs. And not only HIV and AIDS, gonorrhea, chlamydia, right? So I don't want you guys to think that the elderly population is not interested in sex, because that's just not true. They are, and they are the fastest growing group that are getting STDs. Okay, and the biggest reason for that is because they think that because they can't get pregnant anymore, that it's a free-for-all, and that's just not the case. So one of the biggest things when it comes to the geriatric community that you do need to address is using condoms, wearing protection. So number one is the answer: therapeutic medications may alter sexual function. Why? Because many of them decrease the patient's libido. Let's look at the other choices. Choice 2, sexual interest declines and then fades completely with age. We know that's not true. 3, physiological changes do not adversely influence sexual activity. It does. What type of in a perfect example, in women, as women go through menopause, right, they experience sexual dryness. That can affect sexual activity, right? Or physically, the patient's older, they're tired, they can't move the way they want to, and so it may affect their sexual activity as well, right? They may not be able to get into positions they used to be able to get into. So choice number 4, prevention of STDs no longer an issue. Absolutely, it's an issue, and it's the biggest issue for that age. Not it's the biggest issue for the age group. It's a huge issue for that age group. And guys, I've hit my 30-minute mark. So that was our last question. But I promise you, there's going to be a part 2 and possibly a part 3, because I'm going to take my time with this information. Even if I cover 5 questions in 30 minutes, I want those 5 questions to be quality. I want you to get the most out of this. So I'm stopping now, but I promise there's going to be a part 2. And also, as always, guys, if you want to support this channel, please share my videos. Anybody you know that's in the nursing program or just graduated that needs that extra push, share my videos on your social media or with friends. Of course, like and subscribe below and press that notification bell so that whenever a new video is released, you'll be notified. Thank you so much for supporting me, guys. I'm seeing the comments and I really appreciate it. Thank you for spending this time with me, and I'll see you next time.